I have a feeling that Dr. Filippo thinks that rubber dam is a very essential thing in the treatment.
It is the most important. Honestly.
Tell me about it.
You know that this is my favorite topic. I wrote article, book, and I hold hands-on courses on rubber dam. You can find everything. If you type right on Google Cardinali rubber dam, you can find, I think, something that I did in the past. So the rubber dam is really important because, so in my opinion, it is not possible to work without. Because, so this is a really important point, the infection control. But honestly, before the pandemic, was always at the end of the advantages of the application of the rubber dam. So the big advantage is that the rubber dam is our friend. So meets some clinical necessity we have during work. So our work depends on vision, depends on the access to the operative area. So with the rubber dam, we know that we can improve the vision, we can improve the access. And of course, every time you can see better, you can access to the tooth better with your tool. The result is that you can work better. And of course, you work with less stress. Sometimes I cannot apply the rubber dam and I get really nervous, honestly, because everything is more tearing, no? So it's from the position of work, from you work, you see the tongue is moving and you see the suction is, so it's a mess in my opinion. And then we have even a scientific support. So it's something that is comfortable for us. It's something that is comfortable for the patients because we created the so-called, the effect of the patients is that you are treating something outside the mouth because you are not more placing your hands, your mirror, the suction inside the mouth. So this is really important even in patients, they have a gag reflex. So impossible to treat patients with gag reflex without the rubber dam, in my opinion. And of course, regarding endo, you prevent the infection of the root canal system from bacteria arising from the oral mouth. So you are increasing the success rate, you are increasing the power of the cleaning, of the irrigation, just applying a very cheap tool. Probably is the cheaper tool we have in our dental office. So, and the result is that the outcome of the therapy is better. And the same is for the restorative. So I honestly, I don't think there is any kind of reason to not to use the rubber dam. Patients is not asking you to rinse. Is not, the patients cannot speak with you. Sometimes this is an advantage. So it's, I can see just a positive aspect about the rubber dam.
I've actually heard of a joke before, actually from Prof. Massimo. He said that the patient's husband actually asked Prof if where to get a rubber dam because the patient is too noisy at home. So I thought it was a good joke to share with you. But yeah, rubber dam is actually a very beneficial thing because not only it prevents the transmission of the disease for infection control, but it can also increase the success rate for preventing contamination of the canal, better visualization as what you have said. So I think, yeah, rubber dam is a very good thing to do in your procedures. However, I have heard that sometimes people complain that rubber dam application might be a little bit too uncomfortable for the patient. So what do you think about that, doctor?
So it is important first to understand the benefit of the rubber dam, and this is one of the focus of my hands-on course. And then it is important to plan the application of the rubber dam because it is important, really important to motivate the patients. So if you share with the patients your knowledge about the rubber dam or basically the concept, okay, if I'm using this the rubber dam, the treatment will be a better treatment, even if the ends are always the same. I'm always working with the same loops, with a microscope, and even the price is the same. So it is difficult to find the patients that say, oh, it's okay, doctor, and it is not important for me. I want to pay the same for a not so good job. So this is the first point. But then when we apply the rubber dam, we cannot spend too much time, because if you spend 5 minutes, 10 minutes, and the clamp jump out from the mouth, so the patients say, it's okay, doctor, but if it is so difficult, we can do without. So that's why it is really important to plan the isolation and try to intercept all the difficulties arising from the application of the dam in that situation before, in order that when you go to apply the rubber dam, so it's just like a single shot, and in 15 seconds, 30 seconds for a single isolation, or 60 seconds for in a multiple isolation, everything is done. Mm-hmm. And of course, according with the patients and with the treatment, you can choose among 4 application techniques. So there is a strategy, of course, but it's really simple to learn. It's nothing impossible, I mean.
I think I definitely need to practice in how to apply rubber dam faster and more painless, so that the patients would be more willing to accept rubber dams later on. Yeah, but it is a good strategy to tell them how important it is, and it actually costs the same price with or without rubber dam, so why not? Yeah.
Yes. Okay. On the other end, the rubber dam should be something that is in our protocol. You're not asking the permit to the patients to do the anesthesia, right? Mm-hmm. So why you should ask the permit to place the rubber dam? So it's part of the procedure. So now you have, I'm working for 28 years, so probably as soon as I see the patients, I can immediately understand if he's anxious or if it's okay. Is a patient I know that, so I know it's not a problem. But immediately you understand if you have to explain what the rubber dam is, especially at the first use, and or if sometimes you have to apply the rubber dam without saying nothing. So it's part of the procedure, full stop.
That is something new for me as well, because I think it's a very good thing for us to actually see it as part of the treatment instead of an extra thing to do. So it's like you're expected to have a rubber dam on. Okay, that is a very good advice for me as well. Because for me, like, it's always like an extra step. So if patient is not very comfortable for it, I might not choose to do it. But if we see a different point of view, it might actually be better.